Welcome, everyone, to today's episode of Dare to Age Well Now. And I'm excited to be joined by my host, Dr. Jennifer Bourst. Dr. Jennifer, why don't you go ahead and tell us a little bit about yourself?
Yes, thank you for having me today. It's a pleasure to be here. My name is Dr. Jennifer Bourst. I am a chiropractic physician and I've been practicing for 25 years. I practice in Winter Garden, Florida, and we treat people of all ages. We treat children, we treat adults, we treat seniors, and we do that in the means of utilizing chiropractic care. We have massage therapy. I do functional medicine, so we do functional testing, supplementing, quite a bit of nutritional counseling. And then also one of our newer services is neurofeedback therapy. And I like to focus my practice primarily on women and children. That seems to be what I gravitate to and what gravitates towards me and what I find the most enjoyable. So that's why I thought your podcast would be a good fit for what I like to talk about.
Fantastic. And as we visited before while we were prepping for this, we really kind of started digging into this idea of neurofeedback. And I am fascinated. I like to remind people because I think the average everyday person forgets that up until the 1980s, we thought the brain was static. And once it was hurt and injured, you were out of luck. And it wasn't until functional MRIs came about in the 80s that we even knew that your brain could change and that your brain had neuroplasticity. But now we do not have to go and sit in a big fMRI machine. Now we have the opportunity to have this information from our brain so much more accessible. And so tell us more about the neurofeedback. How does it start? When do you recommend it? And I'm so excited about this.
And I can see you've done some homework, so yay for you.
Or I wrote about it in my book. Feel bad.
Yes. So neurofeedback, you're right, has been around for quite some time. It's been researched for the past 40 years, but it probably has been in the last 25 years that it's gone a little bit more popular. But with that, most people still have no idea what it is or what it does. I was actually got a little bit more into neurofeedback therapy and got introduced to it and learned more about it by what I was challenged with my own son who has ADHD. And I had heard that it can help your brain and the synapses in your brain and help you be able to focus and learn better and learn more by doing this type of therapy. And so that's how I got into it in the first place. So what it is it basically it analyzes your body's brain waves to see what is off and what is regulated and what is dysregulated. So we actually use an EEG cap, which is an electroencephalogram. And what it does, it actually reads the brain waves. So the cap actually sits on your head and it has sensors in different areas, different focal sites of your brain. And what it does is it takes a reading of these brain waves as you're sitting there with your eyes closed and then with your eyes open. And the goal of this is to find out what brain waves are regulated and what brain waves are dysregulated. So typically with something like ADHD, you're going to have like more of a high theta brain wave. Something like anxiety, you're going to have more of a high beta brain wave. And something like depression, you're going to have more of a high alpha brain wave. So this helps us kind of diagnose the situation, so to speak, along with looking at your health history, any medical conditions, anything like that. And what it does is this program actually creates a protocol as far as a training therapy goes to best suit your individual needs. So from the EEG, we get a report and it gives us an idea of what's going on and what type of condition that you have, whether we can help you or not. And from there, it comes up with a protocol. And that protocol is basically to give us an idea of the type of therapy and training that we'll do on ongoing sessions at that point.
So you're saying that there is a potential that we can have visualization of what is happening so that I don't know about anybody else, but there are times where I'm just like, is this my imagination? Like I try really hard not to use the am I crazy, but sometimes it feels like there's something that is off. And now we have the ability without this big giant, have to wait until we have a major health event, we can actually proactively go and find out what exactly is happening with us. And then in a minute, I'm going to ask you more about the protocol.
Okay. Yeah, so it's not necessarily a diagnostic tool like an MRI or a CAT scan is as far as looking at any like pathology in the brain. It's simply to read your brain waves, and that's I think a lot of people think it sounds kind of scary, but really what it is it's just a reading of your brain waves. It's just an activity of your brain waves. So there's no input. It's completely non-invasive, safe. Kids actually do really well on it. The actual therapy part of the program is actually simply just sitting there watching a television program or a movie or something that they're actually interested in, that they can sit there for maybe 20 to 30 minutes and actually enjoy a program. So it holds their attention as far as that goes. So it's good for, really we see kids as young as 5, 6 years old and all the way up. And kids, even if they do have something like ADHD or attention disorder, they're able to still sit there and watch a TV program because, what kid doesn't love TV? That's why I like this particular program, because it had that ability to be able to do that with the kids.
That's fascinating. So the protocol I would have assumed would have been go into a treatment facility, into your office X number of times and sit there for X number of minutes. But you are saying that there is a device that is even more accessible than that. Can you tell us more? Because that sounds a little unbelievable that you watching a television show, you can actually receive treatment. So tell us about that.
Sure, I know it sounds interesting, and it actually really is. So, the first visit that we actually see anybody in the office, and we treat kids up through adults with this as well. Like I said, for different, anxiety, depression, sleep, all different types of things, PTSD, OCD. So, what it does is it basically you come in, you do the electroencephalogram, you get the report, and it comes up with these sessions. The sessions, what they are is you're basically 2 to 3 times a week, and you're sitting there for 20 to 30 minutes and you're watching the TV program. And you can do that either in the office, or you can actually have the ability to do that at home. For me and my son, that was actually a better option because we have sports and school and all different types of stuff. So it was thinking, how am I going to get him here 2 to 3 times a week and drive across town, because there is not a lot of providers that actually have this to be able to utilize. So um, when I found out that you could do it from home, I knew that that made the decision a lot easier for us. So we train you on it in the office after we get the protocol for you. Now, if you have initial testing, so you do need to be in the office for that. And for some people, they like to be in the office in a clinical setting where it's quiet and they don't have distraction. And maybe even if it's a child, they can, just allow their child to go in and do it with me. So they're a little bit more settled. Adults like the ability to be able to do it in the office just because it's more quiet and just because they have me helping and setting them up. But in some situations, like in mine, since my son was able to just be able to sit there and watch a TV program without me really having to monitor him at his age, the home therapy was great. So what they do is we train you on it, and then you use your own laptop. The software gets downloaded into it, and then we send you home with some sensors and some other stuff that you need to actually help set your stuff up. And it's easy as just pasting a little sensor on a couple spots on the head. Everything's already programmed into the machine. Just have to turn on Netflix or YouTube to find the best appropriate TV program or movie that you want your child to watch, that you think they're going to be engaged in and interested in. And then you turn it on, you set it up, and you make sure everything's good to go. And when I do it in the office, you can actually see the brain waves regulating and know, what's going on as the child's actually watching the program. I can see the activity of the brain waves and what it's doing. And how it works is that once your brain waves are regulated and the EEG is actually detecting the regulation of the brain waves, the program will actually brighten and the sound will actually get louder. And what that's called is that's operant conditioning. It's actually a reward system. So the EEG knows whenever your brain is regulated and when it's dysregulated. So when it's dysregulated, it's going to dim the screen. It's going to decrease the sound. And so your brain says, hey, wait a minute, I want to see this again. So your brain has the ability to regulate those brain waves without you even really doing anything, just sitting there and just knowing, okay, I get to see the screen. I get this reward if my brain is in a certain pattern, and so it does it all on its own without even having to think about it. So that's the interesting part about it. How that happens, as far as how that sticks over time, is through consistency in training. So I use the example of like learning your times tables for the first time. So when you learn your times tables, you don't just learn them and hear them and all of a sudden you remember, all your times tables. It's a process, and it's consistency, and it's learning and reading them over and over again. And that's the same way with this type of therapy. Sitting down and just doing one treatment isn't going to create those pathways, but over a period of sessions, they say anywhere from 8 to 15 sessions, you start to notice a difference with those symptoms that you're experiencing. And it can take, anywhere from 30 to 40 sessions, even sometimes up to 60 sessions with someone has more of a clinical disorder like an ADHD, someone with autism, someone that has more of a clinical issue, PTSD. If it's someone who has anxiety or depression or having panic attacks or even sleep issues, that might take a little less session. So everyone's a little bit different as far as that go. And we do assess you along the way to see what brain patterns are changing, to see how your symptoms are doing, just to make sure that everything is in line, everything's happening the way it's supposed to be happening. Sometimes we need to tweak the protocol a little bit, but we're able to tell that from the actual the mechanism of the computer and the software and the reports that we actually get.
Now, you mentioned that this is not an official diagnostic tool, so it's not like you're using this tool to say, yes, I see that you have ADHD. Yes, I see that you have PTSD. That's not the situation, right?
No. Mm.
So for someone who is like, I experience the symptoms of ADHD, and I keep talking about that because so many women are undiagnosed, late diagnosed. I was 32 when I was diagnosed. There's this huge barrier to going and getting testing. Sometimes a friend of mine went through the testing, and you have to have people around you fill out this form of what they observe, which is, of course, I teased him a little bit. I'm like, I'm the one that knows this about you. You need some more friends, kid. Um, anyway, but there's just a lot to it. So you're saying that there's a potential that we can, you may not need to do all of that, or this may be a way to kind of get your body and your brain waves in line without having to start there.
Yeah, you don't have to have official diagnosis to get the therapy. I think a lot of people are familiar with their body, aware of their body, know when it doesn't feel right. Now we can go on Google Doc and we can read all about the symptoms and diagnose ourselves, right? So when I personally got my son into this, he didn't have an official ADHD diagnosis, but I pretty much knew that he had it just from reading, research, just what I was experiencing with him. So I have some patients that come to me that do have a diagnosis from a psychologist or from whatever, but a lot of people don't have an official diagnosis. And even though this program doesn't officially diagnose a condition, it is reflective of a condition. So like I said, with someone with ADHD, typically they're going to have a higher delta theta brainwave and a lower beta brainwave. So that kind of triggers us and lets us know, okay, that's definitely lining up with this particular condition that they think they might have. So it's not treating a condition, it's doing a therapy and doing what we call brain training to actually help reset those waves into more of a normal pattern. And in turn, over doing this over a period of time with the consistency and creating those new pathways, the body just learns a different mode. The brain is actually searching out these different modes and these different pathways for more of a positive reinforcement versus a negative reinforcement, which might be some of the reason why someone has anxiety or depression from a past trauma or something emotional or physical that happened to them. And that stays in their head, and that creates those negative brain waves, which creates a dysregulation of the brain waves in the first place. So what we need to do is we need to fix that. We need to retrain those brain waves. And thankfully that's possible with this particular type of therapy.
That is super interesting. And I want to briefly touch on the idea of PTSD because there are, just like I think that someday we will stop calling it ADHD, I've never thought of it as a disorder. I'm like, this is my superpower. And I actually have done another podcast where I talk about that ADHD can be your superpower. in our society, we live in an industrial agrarian society, so we're expected to perform in a certain way, in a certain mechanism, and if you don't, then you're, labeled with a disorder. And I think in the same way, there's some elements of a post-traumatic stress response versus a disorder. And I think that the idea of that is just we get stuck in that response pattern,
Mhm.
to your point. And it's been interesting. I've seen different things can trigger that, right? So I'm going along and I'm fine, and then suddenly I have a death in the family, and it kind of brings a lot of emotions to the surface, and some of these past traumas that I haven't dealt with have now come up to the surface. And so I think it's fascinating. I just want to like bring people's awareness, even if you're not thinking, oh, I have PTSD in a very traditional sense, but I'm easily tripped up. I don't even love the word trigger anymore because it's gotten so much like negative, but really it is like there's an input, we have a response, a stress response, and then we don't go back to homeostasis. And so what it sounds like is this could help even when you're just like, why am I just so upset about this? Sometimes we label it as a silly little thing. And I used to call people into my office and I would be like, hey, can you come talk? And they would sit down in my office. And I was like, okay, so I was thinking about this thing. And they're like, oh gosh, I'm not gonna get fired. And I'm like, oh my goodness, you guys, it's happening in the planet that everybody has this just trauma response. So anyway, can you talk a little bit more about like even that spectrum of not all the way to I have PTS disorder, a traumatic stress disorder, but
Yeah,
um,
I think we all have things in our past. Sometimes it be emotional, sometimes it be physical traumas that it can just stay with us. And again, it gets set in those brainwave patterns, and so anything can trigger it over time. And the unfortunate part is that the even emotional type of experiences that we've had and the anxiety and depression and things like that that we hold on to and affect us mentally, unfortunately they affect us physically as well. And a lot of people don't realize the physical aspect of it. They just think, oh well, I have stress and there's nothing really I can do about it, and it is what it is type of thing. But they don't realize how much that stress actually turns into a physical component, from the nervous system just being taxed all the time, and just from our brain just being out of whack a lot of the time, and just from the shallow breathing that we're doing throughout the day. It creates muscle tension, it creates pressure on our nervous system. So all of these things is another reason why that tends to hit us later on down the road, because it's more of just an emotional response at that point. It's actual a physical chemical response that it can affect, your body, your mind, your spirit, everything in between. Chemically, it can affect our hormones. It can dysregulate, any type of thing along with our brainwave pattern, our hormones, our nervous system, anything. And so that's why in our office, we tend to, over the course of the years, try to be a place where people can come to, whether it be something they need for their brain, whether they need an adjustment for their nervous system, whether they need a chemical balance with hormone therapy, anything like that. We have the means to be able to test them with functional testing and with x-rays and with the neurofeedback with the EEG, and be able to look to see exactly what's going on with the person versus just treating their symptoms. And that's probably the one biggest thing that we try to strive for in our practice, is to make sure that we know exactly what's going on, so to speak, before we start treating someone, just to be able to offer a more individualized approach. You can have two people that have the same exact symptom, but it be caused by two completely different things. So if you're treating the symptom, you could be treating it completely wrong. So I'm a big proponent in testing and finding out really what's going on with someone so that we can best treat them.
I love that. And I think as women reach their 40s and 50s and beyond, it seems to me the conversations are lending themselves more to women really wanting to understand their body, their mind, their heart, what is going on with them. And so I really appreciate you bringing this information and allowing us to share it in such a way that can people can search out this type of healing, and to be able to really take control of our lives and our aging and our body. So, where can people find you, Dr. Jennifer?
They can find me in Winter Garden, Florida. That's where my practice is. That's where I've been for the last 20 years. Also, you can find me online. My website is unityfamilychiropractic.com. The beauty about working with someone with the not only the neurofeedback, but also any type of functional medicine and testing, nutritional counseling, that type of thing. I can do that all via web, online, on the phone. So that's one thing that we've gotten into in the last several years, is because there's a lot of people out there that need the help, and we don't want you to have to just be local and live in Winter Garden, Florida, to be able to utilize our services. So we can actually do anything on the web. So if you go and check out my website, there's a list of all the different services that we offer. Of course, to get an adjustment, you have to be in my office. But as far as any of the other type of stuff, you can look to see what we have available, see if any of the functional testing hits home as far as any of the symptoms you might be experiencing. We work with hormone balancing, metabolic testing, GI and gastrointestinal microbiome type of testing to see if you have any digestive issues or anything like that that's going on in your body. We do food sensitivity testing, allergy testing, even things for like parasites and stuff that a lot of these things people have, and they're contributing to, a lot of their symptoms, whether it be psychological or physical. And so by testing and finding out really what's going on in their bodies, we can, okay, well, we need to do a parasite cleanse, or we need to stay away from these particular types of foods and plan like a better diet for you, or we need to take these bioidentical hormones for your hormone imbalances that you have going on. So it really gives us a better picture on how we can actually help you at that point. So at any point you have questions or anything like that, you can always feel free to call and do a complimentary consultation over the phone, or email me questions. I look at that periodically throughout the day, and I'm more than happy to help in any way.
That's wonderful. Thank you so much for your time today. And
Thank
thank
you.
you all for listening. And I hope that you dare to age well now.